Hello everyone, and welcome to another video from Mindscope Media. Today I'd like to talk about stress hives and how best to treat them. We all experience stress in our lives in one way or another. Do you ever feel rashes on your skin? Chances are that this is due to stress. The development of rashes is a common physical symptom of anxiety. In this video, we'll be talking about stress hives and how best to treat them. Stress is often thought to have psychological effects. Let us tell you though, that it also has physical manifestations. Stress can have an impact on a person's skin. Numerous factors can result in skin problems due to stress. Hives can be triggered by stress, resulting in a stress rash. A hive is a red, raised spot. There are various sizes, locations where they may occur. Hives cause itching in the affected area. Occasionally they cause tingling or burning when touched. To understand what has caused your hives, you need to think about what you're doing or what you have been doing over the past few days. You may experience hives if you make any unusual changes to your routine or encounter something new. If you are experiencing something similar, then you must ask yourself these questions. When did the symptoms begin? Have you switched laundry detergents or soaps lately? Did you eat anything that usually you wouldn't? There is a common misconception that rashes and hives are the same. Skin-related issues, however, differ slightly from one to another. Skin rash is a change in your skin's color, texture, or appearance caused by inflammation. Inflammation can occur as a result of an infection or an autoimmune disorder such as psoriasis or substances that can cause allergic reactions. In response to an allergen, your immune system may release the chemical histamine causing hives. Hives can have a distinct appearance compared to other skin rashes. The most common age group for women with stress rashes is in the 30s, 40s, and 50s. Hives caused by anxiety are also most likely to occur in people with a history of hives. Cold or heat exposure, infection, or certain medications including antibiotic can all cause these hives. Hives are usually caused by an allergen entering the body. As a result of exposure to pollen, an individual may have hay fever, which may develop into hives. A flare-up of hives can also be caused by emotional stress. Responses to stress can lead to changes in hormones or chemicals within the body. Symptoms of these changes can include red and swollen patches of skin when blood vessels expand and leak. Hives can be exacerbated by consumption of alcohol or caffeine, or by exposure to warm temperatures. Acute stress rashes are those that disappear within 6 weeks or less. They are deemed chronic if they last for an extended period of time. There is typically no need for treatment after rashes appear for a few days. In case of the rashes persist longer than this, please seek medical help. Regardless of when hives clear up, they can be uncomfortable. Hives can cause irritation, so it is important to seek treatment in such cases. Stress rashes are also typically mild, but the management of the outbreak can lessen their impact. Rashes, in particular, can cause feelings of unhappiness. A person's stress level may increase, worsening their rash. Hives may sometimes cover the entire body or be accompanied by skin peeling, blisters, fever, and pain. Probably an allergy or an underlying condition may cause this. Consult a physician if this occurs. If you are wondering how long you can expect to be polka dotted, so to speak, I'm sorry to say, but this gets worse before it gets better. New hives appear just as the first welts are fading, which is totally normal, though unfair. Over-the-counter antihistamines can be used to treat them within a few days. Prepare yourself for this final bit of bad news. Even after your hives subside, they may not go away for good. The outbreaks of hives usually come and go in waves and can last for weeks. The doctor can help you figure out what's causing hives if they last more than a few days. Hives are usually not medical emergencies, even if they disrupt your regular routine. When you experience symptoms like fever or swelling of the lips, tongue, or mouth, seek medical attention immediately. Don't ever scratch your hives. Scratching your hives releases more histamine, which, as you might have guessed, leads to more hives. The cycle is thus started. Scratching leads to itching, and itching leads to scratching. In terms of how they are treated and how long they last, stress-related rashes may vary. Stress rash with hives will tend to disappear over time with mild to moderate treatment. To treat stress-related skin conditions such as acne, dermatitis, or severe or long-lasting hives, you may need to visit a doctor. If you suffer from chronic conditions like psoriasis or rosacea, you should work with your doctor to develop a long-term treatment plan. It is possible for new welts to form after a hive. In the case of hives that do not improve after a few days of treatment, more on that later, you should consult a dermatologist. Now let's discuss how to treat hives. We will now discuss how to treat stress hives. Finding ways to relieve your immediate symptoms of a stress rash in the short term is essential, as is finding ways to reduce your stress in the long run. Here are some things you should consider. Number 1. Wear loose-fitting clothing and avoid hot water to ease some of the uncomfortable physical symptoms of hives. Itching and irritation caused by hives can also be relieved by topical steroids such as hydrocortisone cream, cold compresses. Hives can be relieved with over-the-counter antihistamines such as Benadryl, Claritin, and Allegra. If you are feeling acute stress, try taking some fast-acting stress relievers that may provide some immediate relief. You can calm your body and mind with deep breathing and other methods like taking a walk around the block or meditating. It is essential to take some immediate medical attention if your hives are accompanied by other symptoms of an allergic reaction such as swelling of the face and lips, wheezing, and difficulty breathing. This is a sign of severe, possibly life-threatening allergic reaction. A doctor should also be consulted if your hives worsen or persist for more than 6 weeks. Chronic hives cannot disappear by themselves without medical attention if they continue for more than 6 weeks. Now let's talk about prevention. It is essential to identify your triggers and take steps to prevent hives from happening in the first place if you are prone to stress rashes. Stress rash may be a sign that you need to manage stress and anxiety in your life better. Building good stress coping skills is crucial. So here are for you a few practical tools. Challenge negative thoughts. You can feel anxious when you think negatively. Identifying negative thoughts and challenging them can help you replace them with positive, realistic ones. Change your situation. Consider changing a situation in your life that is causing you a great deal of anxiety. It may mean delegating some tasks, reducing your commitments, or setting boundaries with others. Try journaling. Research indicates that expressive writing can reduce anxiety. Think about keeping a journal in which you record experiences and gratitude. Consider professional treatment. Anxiety can negatively impact your life and can worsen over time if left untreated. Having anxiety can significantly affect your day-to-day life and making it more challenging to stay on top of things. These are effective treatments that can help you cope with stress. Hives can make anxiety seem even worse when you're experiencing itchy and uncomfortable skin. Fortunately, anxiety hives are usually treatable by self-treatment. Controlling your anxiety can help you manage stress rashes if you are prone to them. Consult your doctor about some options, which could include medication, psychotherapy, or both at the same time. That's all for this video. Check out our next video and don't forget to like, comment, and to subscribe. Take care and goodbye.